Running is the leading sport to claim injuries in young athletes. Following runners are snow and skateboarders, high-impact dancers, cyclists, skiers, gymnasts, figure skaters, and football, basketball, soccer, and tennis players. Here are the top 10 injuries which plague these types of athletes. Runner's knee, shin splints, sprained ankle, Achilles tendinitis, foot arch strain, tennis elbow, frozen shoulder, neck strain, muscle pull or cramp, strained lower back. Most of the milder strains, sprains, and pulls can be treated at home and should heal by themselves in 5 weeks or less. Just remember the RICE plan of rest, ice, compression, and elevation while your child is recuperating from these types of sports injuries. Be sure to have an ice pack, elastic bandage, sling for arm and shoulder injuries, crutches for leg and foot injuries, anti-inflammatory pain reliever. See your doctor if putting weight on the limb causes severe pain or buckling, you notice red streaks or lumps other than swelling, injury becomes tender to the touch or numb, the injured party is unable to move the joint or muscle. If your child is suffering from any of these sports-related injuries, contact Scarsdale Physical Therapy. We feature a full range of treatments. Scarsdale Physical Therapy.